Well, if you cannot breathe through your nose, and a lot of people of you have been complaining about that because of allergies and all the pollen, it could be, though, more than allergies and even a bad cold. Dr. Ben Paysinger is with the Sinus Center of South Carolina. Some people, doctor, deal with not being able to breathe for several reasons. So we want to show some video because we want to teach our viewers about balloon sinus dilation, which is what we're looking at here. What is this procedure?
Well, it's a minimally invasive procedure designed to open the natural ostia of the sinuses, promoting normal or adequate drainage of mucus. And it's that flow of mucus that keeps the sinuses clean and keeps us uninfected, essentially.
So for people who say, I just can never breathe, how do they know if they're a candidate for this, or they just need to wait it out?
Well, you have to be able to breathe through your nose to have normal sinus function. If you're struggling with breathing, there are other things that we can do to assist you with that. The balloon is for people with recurring or chronic sinusitis requiring multiple courses of antibiotics, have pain, pressure, they just feel lousy all the time. And it just works. It's minimally invasive. It's done in the office under local anesthesia with some mild sedation. The following day, the patient can do anything they want to do. There's no packing, no bruising. Tylenol or Advil if they need something.
So your success rate is very high.
Exactly. It's really working nicely.
And does insurance pay for this?
Yes, finally. Medicare and most of the major carriers are covering it as an in-office procedure, so that reduces the copay and charges significantly.
So could this mean a lot of people could get off medications in addition to just being miserable?
Exactly. Yeah, I mean, if you're not sick all the time, you're not needing to take all of those medications.
Show us this instrument. It looks thin enough, but this goes directly into the nose.
Well, it's all done endoscopically, so we've got a camera in the nose working off of a monitor, and then I'm able to direct this little ostium into the natural, the secret of the natural ostium.
We don't know the difference, don't we? Okay. We'll just trust you.
And once it's positioned, then you slide the balloon forward, and this is filled with air. Usually it's filled with saline, but you simply inflate it, and it's inflated to...
Can our viewers see that? It's just such a tiny, tiny balloon.
Yeah. It's 6 millimeters, but that's anywhere from 2 to 6 times the diameter of a normal ostium.
So people must feel like they get their life back after having this.
We have a lot of very pleased individuals.
Okay.
If you feel better, you're pretty much a happy person.
No doubt. And as far as who this does not work for, it'd be just those patients who would need more invasive type surgeries, like reconstruction or something.
Well, we have a lot of patients with severe chronic sinusitis, polyps. The sinuses are just walled off. They need more aggressive functional endoscopic sinus surgery.
All right.
You know, it's not for everybody, but it's a good first step for most sinus people.
For a lot of people.
Absolutely.
Dr. Paysinger, thank you so much. I'm going to put this interview on my social media sites. There are the addresses. It'll be on there later this evening. Thank you so much.
Thank you.
And we'll be right back.